Today we'll look at a topic that frightens many people: how an invisible glitch in the heart's rhythm can strike the brain and cause a stroke. I'll explain in plain terms why it's dangerous, how to check yourself, and what really lowers the risk. Watch to the end, the most important red flags come last. Atrial fibrillation and stroke. Picture this: sometimes the heart beats out of step, and a person barely feels it. And it's precisely this quiet rhythm glitch that can one day end in a stroke. It sounds frightening, but today I'll explain it calmly, step by step. Atrial fibrillation is the most common sustained heart rhythm disorder in adults. Instead of steady contractions, the upper chambers, the atria, begin to quiver chaotically. Blood mixes poorly inside them, and this is the main cause of future problems. When the atria don't squeeze properly, blood stagnates, especially in a small pocket, the left atrial appendage. A clot forms there. If it breaks off, the bloodstream carries it to the brain and blocks an artery. That's how a stroke happens. Now the figure's worth knowing. With atrial fibrillation, the stroke risk is about 5 times higher than in people without it. And if the arrhythmia is linked to valve disease, the risk can be almost 17 times higher. Atrial fibrillation is to blame for roughly 15 to 20% of all ischemic strokes. And what's especially important, this share rises sharply with age, from 1.5% at 50 to almost a quarter of cases after 80. And these aren't ordinary strokes. The ones caused by arrhythmia run a harder course. In a large study, mortality in the first 30 days was 25% versus 14%. They lead to death and disability almost twice as often. Many people think, if I feel nothing, everything's fine. That's a dangerous mistake. Arrhythmia is often silent, with no symptoms. It's frequently found only in hospital, after a stroke has already happened. Feeling nothing doesn't protect you from a clot. Here it is clearly. From long-term monitoring, symptomless episodes of arrhythmia outnumber the ones you feel by more than 12 times. And in people without symptoms, past strokes are found about twice as often. Silence is deceptive. What actually lowers the risk? The main protection is anticoagulants, medicines that stop clots from forming. It's these, not rhythm tablets, that save the brain. Only a doctor prescribes them, after weighing up your individual risk. A very common myth: aspirin is enough. No. For preventing stroke in arrhythmia, aspirin is no longer recommended as the main option. It barely helps but raises the risk of bleeding. Modern anticoagulants cut the risk of a repeat stroke by roughly 40%. How do you check all this? The foundation is the electrocardiogram, which catches the rhythm itself. If the arrhythmia comes and goes, 24-hour monitoring is added. And an ultrasound scan of the heart shows the state of the chambers and valves. It's all painless and readily available. To decide whether anticoagulants are needed, the doctor tallies up a risk score on a special scale. It takes into account age, blood pressure, diabetes, heart failure, and any previous stroke. Age 75 and over and a past stroke each add 2 points straight away. Now the most important part, the fast rule. A drooping face, a weakened arm, slurred speech, it's time to call an ambulance immediately. Even if the symptoms passed quickly, that's no reason to relax, it's a warning of serious danger. The heart itself gives warning signs too. Chest pain or pressure, fainting, severe breathlessness, reasons for emergency care. And frequent skip beats, weakness, and dizziness, a reason to get to a cardiologist calmly, but without delay. The main thing to remember, a quiet rhythm glitch really can be brought under control. Arrhythmia caught in time and proper protection from clots sharply lower the stroke risk. Don't be afraid to get checked. Knowledge works in your favor. Subscribe and look after your heart. Atrial fibrillation isn't a death sentence, it's a reason to calmly take your heart in hand alongside your doctor. Catching the glitch in time and protecting yourself properly from clots changes everything. Subscribe to understand your heart without fear or needless panic.